Hi, I'm Sharon Heng. I'm a consultant in Moorfields Eye Hospital and I specialize in medical retina diseases as well as cataracts. Medicine is a very enriching and fulfilling career. So when I first wanted to even think about becoming a medical student, it was an academic challenge and it was very daunting. But I decided to take up the challenge and open the world to myself. But as the road comes along, it's very different. It's not just about academia. The academic side was very difficult through the 5 years of medical school. Then you become a doctor, a young doctor, a foundation year doctor. And the challenges that you see as you interact with families, patients with difficult diseases, patients losing their eyes, people being diagnosed with cancer, it really hits you that you're actually doing a lot more. And having the academics behind it, having the skills behind it is just the beginning of a whole journey. So every step of the way in the last 2 decades in medicine for me has been very, very fulfilling. And I've never looked back. So I'm still learning every day and it's still very engaging, very fulfilling. And as the journey goes by, we learn more and more from each other, from patients and families, as well as science and research that's advancing like the aeroplane. So I very much love medicine from the beginning now, and I'm sure in many decades to come. A lot of people don't know that, but actually being able to see the back of the eye is quite difficult because not only do you need to have the skill to hold a little lens to peep through using the peep through the pupils using a slit lamp, everything is actually upside down, left, right, left, right on the opposite sides. So when I first got to look at the retina, finally, it was voila! Oh my goodness, this is so beautiful, and that moment just stuck on it with me. I never looked back. So I ended up doing my PhD in age-related macular degeneration, focused a lot of my training on retinal diseases, did my fellowship in retinal diseases. Every step of the journey is still a learning journey. I'm still very engaged with it, and I just love it. I really love the smile on the patient's face. So after having a surgery, patient walks in, you see that brilliant smile on their face. That just makes you very happy. I think it's my honesty and directness. So I often have very difficult patients that see many people um, and read all across the internet about the diseases or their treatment, and then come into me having a pre-notion of what they feel is best for them, and having I like to evaluate every single treatment available with patients and really talk them through things and tell them exactly what's good and what's not good for them in a very personable and personalized manner. So I think they really appreciate this. So far as I'm concerned, so this is how I deal with in terms of my consultation, and I think honesty is the best policy. I love it when they come in. It's not just about them. It's also about their carers, their families. Sometimes when you talk to them, you know about all their entire history, and it becomes a very close relationship. That you understand their concerns and you share with them their concerns and you try your very best to do the best for them, as well as the input from their family if they wish to. So I find this part of medicine very engaging and in fact very fulfilling, being able to know just not a patient by the disease, but a patient as himself, as well as what he feels about things, his family, and all that concerns his environment. I think my secretary and practice managers will probably know. I always go around and ask, "Is it done yet?"